Let's talk about cardiovascular health. Your cardiovascular system is made up of your beautiful pumping heart and your arteries and veins that connect your entire body in this highway of pulsing vibrance and life force. And it is central to the well-being of absolutely every cell in your body, because this is the channel through which all your nutrients, all of your oxygen, and all of your energy is getting to your cells. So any diseases that affect the fluency and the pace at which this happens are going to have a really measurable impact on your quality of life and on your quality of energy. So I remember at medical school a lecture with an amazing professor called Professor Blockman, and he was talking about how you can gauge what a person's arteries look like by how large their girth is. And we all know that the obesity pandemic is driving hugely chronic diseases of lifestyle: diabetes, hypertension, cardiovascular ischemic heart disease, stroke, depression and anxiety even, and also cancer diagnoses. More and more we are beginning to understand that metabolic health, so the health of the whole system, how well you metabolize and break down carbohydrates, how well your body is able to extract nutrients out of the food that you eat and make sure that the level of sugar in your bloodstream is well regulated, how well your heart is beating. Remember, a normal heart rate is between 60 and 80, but the more fit you are, the slower your heart rate is. In fact, I was thinking the other day that you can think of your heart as the metronome of your life. And the more physically fit you are, remember your heart is a muscle, and the more you exercise a muscle, the stronger it gets, and the more agile and resilient it gets, the slower your heart rate becomes. And there's this beautiful relationship between how you perceive your heart rate, whether that's conscious or not, and the level of anxiety at a brain level. Everybody who experiences anxiety, whether it's pathological or not, will know that when you're anxious, your heart rate shoots up, and you can feel that heartbeat whooshing in your ear or whooshing in your neck. And when you hug somebody who's anxious, you can feel it in their chest. And the better equipped we are to slow that rate, the more likely we are to feel more grounded and more held in our bodies. So how do we slow our heart rates? We slow our heart rates by paying attention to our breath, and we slow our heart rates by being physically fit. We'll talk specifically about musculoskeletal health a little bit later, but I always say to people that your body has got a few hundred different muscle groups, and your brain is one organ. And we spend a disproportionate amount of time investing in our cognitive function compared to investing in each of these beautiful muscle groups that really should be honed so that we could be swinging from the trees and lifting heavy things and not struggling with pain in our bodies. In fact, let's talk about musculoskeletal health now, because I actually feel like it's so integral to cardiovascular health, and they speak so eloquently to one another. When you are not using your musculature in the way that it was designed to be used, you will notice this kind of low tone posture in people, this almost an apathy of the body in posture. We spoke about that Rodin statue, and that even that dropped head looking down at your phone mimics and speaks to this posture that I'm describing. And we're all familiar with it. A paunch, lots of beers on the weekend. All of these things contribute to that metabolic health that I described in the beginning, that is going to be a reflection of what the inside of your arteries look like. So let's talk for a minute about blood pressure. The thing about blood pressure is that even if your blood pressure begins to creep up incrementally, you are not necessarily going to perceive that anything is amiss. And your cardiovascular system is going to transport that blood flow adequately for a couple of years, maybe even a couple of decades. But what begins to happen over time, because that arterial system is not geared for the pressure that it's been beating at, the integrity and health of the architecture of that system begins to break down. And so you might have fraying or dilatation or atherosclerosis, so cholesterol coming to try and heal those little damaged parts in the endothelial lining of your blood vessels. And all of that is going to lead to poor perfusion. So it's going to lead to poor flow of blood to whichever organ system is being affected. And that's really what we see when people get angina or chest pain, because there's narrowing of those blood vessels and the heart muscle is not getting the adequate amount of oxygen and nutrition that it needs. The same thing happens in the brain when somebody has a stroke. We get narrowing, or we get a clot shooting off and blocking an artery, and then suddenly the area of the brain that's perfused by that little highway is now blocked like a traffic jam, and the cells that are being starved of oxygen and nutrients begin to die, and that's when we lose bodily function. So you can hear that cardiovascular health is quite a broad topic, and there are so many things that fall into this category. But if you have one takeaway from this talk, it's to use your body in the way that it was designed to be used, and to focus on creating cardiovascular health that is a level of fitness that slows your heart rate, that keeps your blood pressure down, and that keeps your waistline trim. I think next we're going to talk about insulin resistance.